What is pneumonia? Pneumonia is infection of the lungs, where the lungs are totally filled with exudate because of the infection by organisms. There are so many organisms, at least 15-20 organisms that can affect lungs. In this, we have different types of pneumonias: community acquired pneumonia, hospital acquired pneumonia, pneumonia in risk factor group. The most common is the community acquired pneumonia, where the lungs are infected in children or adults at home and in the community, which is mostly due to microaspiration of the oral flora. The flora, what we have, the organisms in the mouth, they are slowly microaspirated in the lungs, and that will cause infection, inflammation, collection of exudate. That is nothing but solidification of lungs and pneumonia. This is about definition of pneumonia. And what are the risk factors for pneumonia? Which patients will get pneumonia? Children who are asthmatics are prone for pneumonias. Winter and rainy seasons, cold temperature predisposes to pneumonias. I am talking about this community acquired pneumonia in healthy individuals. How they present? They present with cough, sputum may be there in adults, high grade fever. Children may not have sputum, usually they take the sputum inside. That's why they don't bring the sputum out. But adults may have yellowish sputum with cough and high grade temperature. These are the symptoms, and immediately you should contact your family doctor, family physician, or pediatrician, where he will go for blood counts, which will show the infection, and X-ray will show pneumonia. What is the treatment? What are the investigations? A simple complete blood picture will help us detecting the infection. Sputum examination, which is very difficult in children, we can take gastric lavage and test it for which organism has caused the pneumonia. In adults, we can test the sputum examination itself to see what is the organism causing pneumonia. And X-ray, blood counts, sputum test, and X-ray. X-ray will help us what is the extent of pneumonia involved, how many lobes are involved, and is it a serious form of pneumonia or simple patch pneumonia. What is the treatment? Pneumonia can be treated by various antibiotics. If it is mild, oral antibiotics, single or combination of antibiotics. These antibiotics attack the organisms, they kill the organisms, and usually patient improve within 48 hours. X-ray may take some time to improve, like 1 week or 10 days. Antibiotics, suppose the pneumonia is severe, you need to hospitalize the patient for a day or so, treat with injectable antibiotics, then switch over to orals for 5 days to 1 week, and patient will recover totally. How to prevent pneumonias? Be careful in winter seasons, especially high risk groups like elderly people or children. They are the high risk groups: patients with diabetes, patients with kidney failure. All these are high risk groups for pneumonias. So all these people who are high risk for pneumonias should be vaccinated with vaccine. Pneumonia vaccine is available that can be taken every 3 years. That is one measure for prevention. And patients who are asthmatics and risk groups like diabetes, they can have flu shots also. Usually flu shots, once the patient gets an episode of flu, he may have secondary infection and pneumonia. So to prevent pneumonia, we may have to prevent flu. To prevent flu, we will have to give a flu shot every year. So these are the preventive measures, and maintain good hygiene during the rainy season and winter seasons, and maintain good hydration and nutritional status. This may help in preventing pneumonias.